Okay, friends, very good evening. Here, this is Sharad, President of the Rotary Club of Guindy. Welcome one and all to the event by the District Prevention and Treatment, along with the regions 10, 15, 17, and 21. Let us have a wonderful session and let us hear more about hormonal disorders. So if I go a bit brisky here and there in the meeting, it is not due to any hormonal disorder. It is only because of the fatigue of Zoom. So can I invite
Sharad, konchu volume, Sharad.
Yeah. So can I invite the Disha for the invocation song?
Yeah. The song which I'm going to sing today is from the movie Kapan, lyrics by Kavinyat Vairamuthu and music by Haris Jayaraj. I am very proud to be a part of this song. விண்ணில் விண்மீனாயிரம் வானம் ஒன்று மண்ணில் பூக்கள் ஆயிரம் பூமி ஒன்று விண்ணில் விண்மீனாயிரம் வானம் ஒன்று மண்ணில் பூக்கள் ஆயிரம் பூமி ஒன்று உடல் நிறம் மாறலாம் உயிர் நிறம் ஒன்றுதான் பேரன்பால் ஒன்றாய் சேரும் தேசம் நன்றுதான் தொழும் முறை மாறலாம் இறை இங்கு ஒன்றுதான் நம் ஈஸ்வரல்லா தேவன் எல்லாம் ஒன்றுதான் விண்ணில் விண்மீனாயிரம் வானம் ஒன்று மண்ணில் பூக்கள் ஆயிரம் பூமி ஒன்று ஒற்றை தேசம் என்றும் ஒற்றை வாழ்க்கை என்றும் யார் நினைத்தாலும் திணித்தாலும் நிறைவேறுமா பல வண்ணங்களால் செய்த ஓவியம் போல் ஒரு நிறம் கொண்ட படம் என்றும் அழகாகுமா வேற்றுமையில் அழகியலுண்டு வேற்றுமையில் ஒற்றுமை நின்று சகிப்பென்னும் பண்பாடு படைத்த நிலம் இது விண்ணில் விண்மீனாயிரம் வானம் ஒன்று மண்ணில் பூக்கள் ஆயிரம் பூமி ஒன்று விண்ணில் விண்மீனாயிரம் வானம் ஒன்று மண்ணில் பூக்கள் ஆயிரம் பூமி ஒன்று. Thank you.
Thank you, Annette Disha. That was a wonderful invocation song. Maybe you should try in Super Singer Junior Idols. You have a wonderful voice. Thank you. Now, can I call upon to render the four-way test the president of Pinnacle Rotarian, Hemlata Johnson.
Thank you, Sharad. Yeah, can I go ahead? Can you hear me?
Yeah, please.
Yeah. The four-way test. The four-way test of the things we say, do is a test used by Rotarians worldwide as a model.
Hemlata, first just request everybody to mute themselves. We can't hear you.
Done speaking.
Jayashree, you can manually mute them. Yeah. Yeah, Hemlata, you can please go ahead.
Yeah, the four-way test. The four-way test of the things we say or do is a test used by Rotarians worldwide as a model code for business and personal relationships. The test can be applied to all aspects of life. The first one of the four-way test is it the truth? We are very familiar with the term the truth and nothing but the truth and what it implies. The message is that what is said in a court of law is the truth. If you don't tell the truth, you're guilty of what is called perjury. The second one is it fair to all concerned? This requires that everyone in a relationship be treated fairly, including us.
Hemlata, you've muted yourself.
Yeah, Hemlata, you have to.
Shall I continue?
Yeah.
This requires that everyone in a relationship is treated fairly, including ourselves. Fairness means that we treat everyone with justice, equality, and given a fair share. The third one is, will it bring goodwill and better friendship? The term goodwill in a personal sense means doing something from a position of kindness and compassion in the friendly hope that the action will succeed. Goodwill and strong friendship are the invisible glue that holds strong clubs together. The fourth one is, will it be beneficial to others? We must stop to consider how our actions would impact those important to us. Will our words and action help others grow? We should be working to help all improve in our skills and abilities in order to raise level of consciousness, feeling of empathy towards others, and feeling of self-worth within us and others. Therefore, think before you act. Thank you.
Thank you, Hemlata. The four-way test is one of the shortest thing in Rotary ever heard. So I think you will hold a good record for making it so explanatory and making everybody understand. Thank you a lot. Yeah. Can I welcome the most dynamic, the most charming, the most resourceful, our own Dr. Vasudha, District Chair for Disease Treatment and Prevention. Yeah, it's all yours, dear Dr. Vasudha.
Thank you, President Sharad. I thought you were talking about somebody else until you mentioned my name. So thanks a lot
Probably
for those.
I could have added 2 more 3. Sorry, then it would have been more apt for you.
Thank you very much. Good evening, everyone. This is the third part of the series, which I think this group of clubs and regions call themselves what? Karaikal Kales or something like that.
Karaikudi Kales.
Karaikudi Kales. Yes, sorry, my bad. Karaikudi Kales. And this is the third part of the series. The first one, which we did, was on heart attacks. The second one, which we did on brain stroke. When we were discussing, when Reggie, Vidya, I and Hemlata were discussing about what the next program, and of course, A.G. Ramkumar was the main person I discussed with. And we were talking about, should we do diabetes or, and then we thought diabetes alone, because it is related to the strokes, heart stroke and brain strokes. But then diabetes itself is a much beaten about problem. And there are so many other, diabetes is also a hormone problem, but there are so many other hormone problems which also exist commonly. And most people don't know, they're not aware. At the most, you may say, I have thyroid, but you don't know what thyroid, is it hypo, hyper? So when Ramkumar and I discussed, and then when I discussed with Hemlata, Reggie, and we thought we should talk about hormonal disorders. And what better person to talk to us than Dr. Jayashree Gopal. Somebody else will be introducing her today. But I only want to mention one more line about non-communicable diseases. For people who have not heard me talk about this, our Rotary National Health Mission's agenda, or I would say focus now after eradicating polio, is non-communicable diseases. What is non-communicable diseases? These are diseases which don't communicate by touch. It's not like a fever or a typhoid or a cholera or even a malaria. So they're not infectious diseases. So you call them non-communicable, like non-infectious diseases. And more, because in the last 25 years, there's been a paradigm shift in Asia, especially in India, from communicable, infectious to non-infectious diseases because of lifestyle changes, so many other changes. And we are seeing more and more premature deaths. 65% of deaths between the ages of 35 and 70 are due to non-communicable diseases, out of which 80% are due to heart diseases related to unhealthy lifestyles and hormonal disorders. So I'm so glad that this group of regions of clubs have been doing these series. And I thank you very much for holding this program today. Over to you, Sharad.
Thank you, Dr. Vasudha. It's our pleasure. To introduce our chief guest, Dr. Jayashree Gopal, may I invite Rotarian Sheila Janet to introduce her. Over to you, Sheila.
Thank you, sir. Good evening, everyone. It's a great pleasure for me to introduce our guest speaker today, who is going to talk to us about the common hormonal problems. It is a privilege and an honor for me to deliver an introductory speech on Dr. Jayashree Gopal, and I thank Mr. Elangelian for having given me this opportunity today. If I have to tell all about ma'am's achievements, this day wouldn't be enough. So I'll try to make it brief and clear within the time given to me, ma'am. Dr. Jayashree Gopal is a renowned diabetologist and endocrinologist with about 20 years of clinical practice. She currently is the director for Diab Endo India at SIMS Institute for Diabetes, Endocrine, Metabolic and Lifestyle Diseases. She's also a consultant endocrinologist and diabetologist at Sitapati Clinic, an associate dean for teaching and research at MV Diabetes Research Center, Royapuram, Chennai. She did her schooling in Rosary Matriculation Higher Secondary School and Vidya Mandir Higher Secondary School during the year 1972 to 85. She completed her postgraduate in medicine from Government General Hospital, Chennai. She then was the senior house officer in medicine and pediatrics at GH Chennai. She did her residency in internal medicine at Baylor College of Medicine, Houston, USA, clinical fellow in endocrinology at Baylor College, research and clinical fellow in endocrinology at MD Anderson Cancer Center, Houston, research fellow in endocrinology at University of Cambridge, London, registrar in diabetes and endocrinology at Ashington Hospital in London, registrar in diabetes and endocrinology at North Tees Hospital, London, registrar in diabetes and endocrinology at Royal Victoria Infirmary, London. With her 2 decades of clinical experience, she has also authored several research papers and book chapters on diabetes, endocrinology, and other hormonal disorders. She has also published many books on diabetes and endocrinology. Dr. Jayashree is also interested in gathering and compiling data on common endocrine problems and on setting up an education program for the self-management of diabetes. She helped to set up a scheme for the children in a small village through an outreach program. She was the convener of the Health Care Panel CII Chennai Zone from 2011 to 13. She was awarded the gold medal for the woman holding first rank in India in the class 12th in 1985. She was also awarded Rolling Cup for standing first in English and has also achieved many distinctions in biochemistry, pharmacology, and surgery. She was also awarded the Dr. Sam G.P. Moses Oration at the API Chennai Chapter Annual Conference in September 2018. Dr. Jayashree Gopal, MBBS, Diplomate of IM, Diplomate of Endocrinology, is one of the best endocrinologists and diabetologists in Tamil Nadu. It is, again, indeed an immense pleasure for me to welcome ma'am once again. On behalf of all the host clubs, I welcome Dr. Jayashree Gopal to deliver the speech for today on the Healthy You. Thank you all. Thank you once again.
Thank you, Sheila. It was a wonderful introduction.
Thank you.
With so much of introduction of Dr. Jayashree Gopal, I'm sure we will be enlightened with all the knowledge she has. Over to you, Doctor.
Thank you so much for this very, very kind introduction, Ms. Sheila. Just one thing before we start, Vasudha, in case my audio goes, because I'm in sort of an unstable connection, just call me on the phone, please. Because sometimes, thank you.
Have you given her screen share, Rishdan? Sharad, we need, Jayashree, do you have your screen share?
No, not yet. Not yet. I'm waiting.
Yeah, I have done.
Okay, thank you, Rishdan.
I'll try. Yes, now I got it. Can you see my screen?
Yes, it is clear, ma'am.
Thank you. So before I start, I just wanted to say a hello to some familiar names I see in the audience. First of all, Vasudha, thanks so much. Vasudha, I wanted to tell Mr. Sharath that Vasudha has been even more dynamic, I think, from what we remember her in college. So I think you described her perfectly. I have not seen Vasudha for many, many years, and it's an absolute pleasure to see her again. Also, Mrs. Geeta Sheshadri, a very, very good friend's mother, and her daughter Revati and I, we've been schoolmates and college mates. And I think actually my mother is there, Mrs. Shanti Gopal. I've also been, I don't know, maybe you can call me a Rotary baby. I grew up with Interact, Rotaract, Rotary. My mother is a very, very active member of Innoveed. So I always enjoy coming to, the Rotary. It's like coming back home is what I always say. So thank you again for this very nice invitation. Today, I'll try and keep the talk as brief as possible. I'm not going to load you with facts. I want to just share some of my understanding about hormone problems with you. And we'll talk a little bit about how we can maintain a normal, a good hormonal balance, which ensures good health for all of us. Yeah. So hormones are important basically for communication. I think we understand this. Hormones are the way in which, for example, if we've not eaten for a few hours, our brain gets the signal we are hungry. That occurs because of a certain hormone that is secreted from the stomach. When it gets dark outside, when we turn off the lights and our brain tells us it's time to sleep. It's again a hormonal communication that tells us that it's time to sleep. So every single sort of interaction of ours with the environment occurs because of hormones. And hormones are the ones that sort of knit together the various parts of our body and keeps it working as a whole. So hormonal balance is very, very important, obviously, as we can imagine, for our health. And hormones help to keep various aspects of our body in balance. So what do I mean by that? For example, we see something that frightens us, we get a sudden scare, our heartbeat immediately picks up, and then it takes a few minutes for it to come down. We listen to something disturbing, some news or something like that, our heart rate goes up, it takes some time to come down. So there are second to second variations in our heart rate. Even minute to minute, things in our blood, for example, our sodium levels, our blood sugar levels, our blood pressure levels, these things also vary from minute to minute. And there's also a lot of variation over a period of time in our sleep, in our body fat. Body fat is basically a good demonstrator of the energy stores in our body. If we have a lot of body fat, it means we have a good surplus of energy stores. Our bank balance is very good. If we don't have enough body fat, it means that we do not have enough of energy stores. So all of these are this adjusting, this minute to minute variation, hour to hour variation, or over a longer period of time setting right. We all know that over a period of time, sometimes there are periods in our life when we sleep less. There may be sort of few days when we sleep less, but we feel fine. There may be times when we have to sleep more. We may feel like sleeping 9 hours a day, 10 hours a day, and then only we feel refreshed. That is all our body's way of resetting the balance. So we should always learn to listen to our body. And this sort of resetting of the balance occurs because of hormones. The body senses changes in various aspects of our environment, various aspects of our internal health, and it responds to these changes and tries to get it back into sort of the normal hormonal basic state. And this occurs because of hormones. And hormones are particularly important for maintaining everything just right. And my favorite example in this is sugar and body fat. We all know that high blood sugars is bad. We all know that low blood sugar is also bad. Low blood sugar is very unpleasant. People who have diabetes know it. When your sugar levels drop, you feel very weak, tired, you break out into a sweat, you feel very hungry. So hormones are the ones that keep the blood levels of the glucose just in the normal range. But it's not only about this, it's also about body fat. We all have heard so much about how excess body fat is bad for us. If your body fat is high, you get this and you get that, and we know enough about it. Again, when the body fat is too low, also it is not good for us. So we need just the right amount of body fat also. So everything in our body, whether we take sodium, whether we take blood pressure, blood sugar, body fat, sleep, any aspect of our body, it has to be just in that right Goldilocks zone. It shouldn't be too much or too little. And hormones are the ones that keep it in that good zone, in the green zone, if you will. This is probably the only sort of medical looking picture that I'm going to show. And it shows all of our endocrine glands, starting from the pituitary to the thyroid and so on and so forth, including the kidney is also a type of an endocrine gland because it makes a certain hormone. Of course, ovaries, testes, pancreas, Vasudha mentioned it. It is very important source of insulin, which is one of our most important hormones. So these are all the endocrine, what we call endocrine glands in our body, which make hormones. The pituitary gland is what we call the master gland. So the pituitary gland is one tiny little, it's the size of it's slightly smaller than even a pea. It's only about 9 millimeters in height usually, and it is present deep within our brain. If you draw a line from sort of the base of the nose back, about 6 centimeters from there will be the pituitary gland. And why is it called the master gland? Because it makes the hormones which controls the other glands. So for example, it makes a hormone that controls your thyroid or your adrenal or your ovaries. So it makes hormones which controls the other parts of the endocrine system. So that is why it is called the master gland. One of the most important hormone it makes is growth hormone. Growth hormone is a hormone that is needed mainly for children to grow taller. Adults also need some amount of growth hormone to maintain our muscle strength. If you look at people sometimes over the age of say 80 or 90, you will see that they've lost a lot of their body fat and they've become very thin and frail. They may be, sort of stooped over, bent, but also their muscle mass is gone. So when they are that old and the body fat goes away, this is because of the lack of growth hormone at that age. But at a younger age, if you have too much growth hormone, remember I told you hormones are all about balance. It's all about balance. When you have too much growth hormone, you tend to be very tall. So this is a picture of a person who had excessive secretion of growth hormone in his body. This picture is probably more than about 80 or 90 years old because we would not see this in this day and age. We have ways of picking this up and treating it, which was not present. So this is a person who had excessive secretion of growth hormone from a very young age, so that he grew very, very tall. And this is compared to his other family members. These are his parents and his sisters. So this is a person who shot up a lot because of too much growth hormone. He became a giant. I don't know how many of you recognize, how many of you are into football. This is a picture of Lionel Messi, who is one of the probably considered the best footballer in the world. And this is a person who was diagnosed with growth hormone deficiency, the opposite problem. When he was a young child, it was found that his body did not make enough growth hormone. So these children typically present with being very short. They'll be much shorter than their classmates. They get teased in school a lot. They tend to be relatively weak and tired because growth hormone is also needed for muscle strength, for running around. So these children tend to be sort of small, weak, tired, bullied a lot. And he was treated with growth hormone at the correct age. The diagnosis was made. He was treated with growth hormone. And you know where he is nowadays. Again, about balance. Too much growth hormone is bad. Too little growth hormone is also bad. Now, another important couple of hormones which come from the pituitary gland is a hormone called prolactin. Prolactin is the hormone which is responsible for milk production. When a lady is pregnant, it is important for the lady to make milk for her baby, for the mother. For that, prolactin is important. If you do not have prolactin, you cannot make milk for the baby. Another very important hormone whose function only really started being known in the last few years is this hormone called oxytocin. It's a fascinating hormone because this hormone is actually released at the time that the baby is being born in the mother. That is when you have a very high oxytocin surge. It is what is popularly called the love hormone. So this surge of oxytocin that occurs during birth is what is responsible for the very intimate bond that develops between mother and child. Fathers also make it. I'm not leaving out fathers here. Both fathers and mothers have the surge of oxytocin at the time of the birth of their child. And this is what helps in bonding. And all sort of, a lot of animals. It's not just unique to humans. A lot of animals which particularly have this sort of family behavior, it occurs because of this hormone oxytocin. And that is why in the popular press, it was called the love hormone. From the pituitary, I'd like to talk a little bit about the other sort of very popular and well-known gland, which is the thyroid gland. And the reason I put these arrows is because thyroid ultimately is controlled by pituitary, but in turn, it also controls the pituitary gland. So all of these glands will interact with each other. The pituitary, yes, controls the thyroid, but thyroid will also control the pituitary gland. So there is a feedback. Thyroid is what we call a butterfly shaped gland. You can see it is present here in the neck. It's this little thing present in the front of the neck here. And it makes something called the thyroid hormone. We all hear about it. One thing which I neglected to mention, and I will say it again, every hormone in our body has an action on every cell of our body. So whether it be insulin hormone or growth hormone or oxytocin or prolactin or thyroid, it has an action on every single cell in our body. So hormones are important for normal working of every single cell of our body, whether it be our hair cell or our brain cell or our skin cell or heart or lungs or intestine, any part of our body, it is dependent upon pretty much all of the hormones to be in balance to keep it working. Now, this is a picture of a person who had what is called cretinism. Again, this is not something we are going to see commonly nowadays. So cretinism happens when you are born with very low thyroid levels and it is not recognized and treated in time. And you can see the classical features. This is a person, I think this woman was in her 40s or 50s when this picture was taken. And you can see that the hair is it tends to be very dry. The face tends to have this very characteristic appearance. They tends to be swollen. They tend to have a low IQ. They tend to be retarded. The face is swollen up. You can see there's a lot of puffiness of the face. The skin tends to be wrinkled. So this is a very classical picture of somebody who does not have enough thyroid hormone in the body. Another common problem that may occur is this. Some people develop a big swelling of the thyroid gland. That's called a goiter. Again, these are all very rare nowadays because we have a lot of countries around the world and more in India. All newborn children need to have their thyroid levels checked soon after birth. So within a week after birth, they need to have their thyroid levels checked. And if they have a low thyroid hormone level, they get started on thyroid tablets. Now, this is the opposite problem. Again, I'm sure all of you recognize her. This is Sadhana, a very, very popular heroine in Hindi movies in the 50s, 60s. And this is a picture of her, I think her first movie. I think those of you who are familiar with Hindi movies will know it. This is her in her first movie, Hum Dono. And you can see how her appearance changed by the time about, I think, 12 to 15 years later. She developed a condition called hyperthyroidism, overactive thyroid gland. So again, this is the opposite. I showed you pictures earlier of a very person who developed a high thyroid, and she started developing some changes in her eye related to the hyperthyroidism. Again, thyroid, like every other hormone, it is very important that thyroid hormone levels also be kept in balance. And when thyroid levels are high, you tend to lose weight, you tend to be, your heart rate goes up, you tend to have a lot of sweating. Both low thyroid and high thyroid will leave you feeling very tired and depleted of energy. Low thyroid may cause a bit of weight gain. High thyroid definitely causes you to lose weight. So these are all, both low and high thyroid can impact upon periods, particularly for women. Periods can become irregular. They may have difficulty getting pregnant. So thyroid, again, is a very important hormone overall for our metabolism. And an interesting fact about the thyroid, again, like all hormones, thyroid hormone is something that evolved a long time ago. We are not the only sort of animals that are unique in having thyroid hormone. Thyroid hormone is very important in frogs. It may not turn a frog into a prince, but thyroid hormone is the most important hormone for what we call metamorphosis. So it is important for the turning of the tadpole into the frog. In fact, if the tadpole does not have thyroid hormone, it will remain a tadpole, interestingly. So this sort of this development of a tadpole into a frog, thyroid hormone is important. And each hormone has a different sort of effect in different animals. In the frog, this is what it does. Moving on to another important gland, what is called the adrenal gland. So the adrenal gland is present in all of us on top of the kidneys on both sides. And it makes, I think the hormone that we'll be familiar with it from the adrenal gland is what is called epinephrine or adrenaline. We have all heard of the adrenaline rush. It is called the stress hormone, or anytime we have to get our heart rate up, we see something, we have to run away from danger. That is what is called the fight or flight hormone. So it makes our heart rate go up, it makes our muscle more strong, and it prepares our body for a fight or a flight. So that hormone is made by the adrenal gland. Again, when you have too little of adrenal hormones, you may develop a condition called Addison's disease. Again, I think some of you may recognize, this is of course a picture of the American president, John F. Kennedy. John F. Kennedy had Addison's disease. And he had, one of the things that happens in Addison's disease is that you develop a tan. You tend to become a little bit darker on the face. And they thought that he had a wonderful tan from, being sunning and, going to Florida, the beach and so on and so forth. But what he had was Addison's disease, and they tend to develop this pigmentation of the skin. So this is a famous person who had low adrenal gland levels. The opposite problem, when you have too much of adrenal hormones, in this case, it is a particular hormone called cortisol. When you have too much of adrenal hormones, you may develop a condition called Cushing's, the opposite problem. You tend to gain weight. You tend to develop these sort of what we call striae or stretch marks, which are, not the usual stretch marks that we see because of weight gain. You can see that these are very much red in color, and they tend to be very broad in width. So these are all problems, again, because the adrenal gland either makes too much or too little hormones. Again, driving home the point that all hormones need to be in balance. So finally, I'm going to spend the remaining few minutes left to talk about a very important hormone that sort of unites all of this together. I know Vasudha said she did not want to talk about diabetes, but I have to talk about insulin. Insulin is one of the unique hormones which our body makes, and not just for diabetes. In fact, I'm not even going to talk about diabetes. And the reason I put an arrow against pancreas and ovary will be clear in a minute. I'll just tell you that. Just give me a minute, please. Yeah. The reason why insulin is such an important hormone is because it is a central hormone in metabolism. There is no other hormone in our body like insulin. Every other hormone has sort of checks and balances. Insulin is unique in that there is no other hormone that mimics it. There is no other hormone that has its exact same action. For some reason, insulin is such an important hormone that it only evolved once. There are some other hormones in our body which mimic some actions of insulin, but no other hormone in our body can replace insulin, which is why we have the very distressing problem of what we call type 1 diabetes, where the body does not make enough insulin. When your body does not make enough insulin, we do have to give insulin from outside to control the blood sugars. But I'm not going to be talking about just blood sugars today. I just put up this picture to ask if you're aware of the link between. This is a picture of a person who's gained some amount of body fat, particularly around the tummy. And this is supposed to be a person having a heart attack. So I put this up to sort of discuss the point about what is the link between just this, gaining a little bit of weight around the tummy. We all know it is bad. We've heard a lot about it. And heart attack. Why should gaining about 4 to 5 kilos around the abdomen lead to a heart attack? And it occurs because of this condition called metabolic syndrome. It's a very interesting story. When I went to medical college, it was just being deciphered 20, 25 years ago is when we started understanding the link between that little bit of excess body fat and heart attacks. So what people knew was that people who had heart attacks and strokes, some people said it was predominantly only because of cholesterol. Other people said it was only because of blood pressure. Then we understood that some people it happened because of high blood sugars. There were other people who said, no, it is because the blood is very sticky. It clots very easily. That's why they're getting heart attacks and strokes. So literally it was the case of 6 blind men and the elephant. Each person, each researcher, each doctor who was looking at his or her field only could see what he could see. He could not see the whole picture. Only in sort of the 80s and late 80s and early 90s did we begin to understand that that increased risk of heart attack and stroke occurred because of all of these mechanisms, and that all of these mechanisms in turn was occurring because of all of these various mechanisms, the high blood sugar, all of these things that I mentioned occurred partly because of excessive tummy fat, excess amount of deposition of fat around the abdomen, the belly fat. And what that causes is our body's insulin to not work properly. So that little bit of increase in the tummy fat, for some reason, tells our body's insulin to start working less efficiently. And why is that so important? Remember, I said insulin is a very central hormone in metabolism. So when that insulin is not able to work efficiently, it causes this condition called inflammation. I think all of you have is sort of like a, what can I say, a little bit of a slow burn. I think of it as a slow burn. You know, in the gas flame, if you put the flame in a slow burn and you let things cook, that is what is happening in our body if we leave it in the state of inflammation. Everything is cooking slowly and causing damage over the long period of time. So inflammation is what we call slow burn. Inflammation is what is responsible for a lot of the non-communicable diseases. As Vasudha correctly pointed out, non-communicable diseases is what is the current pandemic. Before the COVID-19, after the COVID-19, the pandemic we are left with dealing for pretty much the whole world is non-communicable diseases. Large burden of those non-communicable diseases is occurring because of inflammation. Excessive inflammation in our body, which in turn is predominantly related to insulin resistance, which in turn is happening because of excess body fat, predominantly around the stomach. So I hope you can understand where I'm leading with this. This inflammation in the body has been linked not only to things like heart attack and stroke, what is mentioned as cardiovascular diseases, cancers, breast cancer, lung cancer, arthritis, skin conditions like psoriasis, diseases of the intestine like colitis, asthma, allergies, even things like infertility, PCOS, irregular periods. All of these things occur because of this insulin resistance and inflammation. A lot of our non-communicable diseases, and the reason I'm mentioning it is because non-communicable diseases and its development is under our control. We can prevent it from happening provided we start early enough. The WHO, the World Health Organization, is saying that 70 to 80% of non-communicable diseases can be preventable provided we start early enough. We have to target children. I know the Rotary did a wonderful job in controlling the big drive towards hepatitis B. And I'm so glad it has taken up non-communicable diseases, because you have to start attacking the problem at the roots. You have to start with very young children. You have to concentrate on the adolescent age group. You have to concentrate on the young adults, because ultimately the roots for all of these, this insulin resistance, weight gain, inflammation starts in the 20s and 30s. And we have to concentrate there and make sure that people are aware of how to eat healthy, how to look after their lifestyle, so that all of these other diseases do not develop by the time they reach their 50s and 60s. So how do we ensure that our body's insulin works well? How do we ensure overall that all of our hormones are in balance? I spoke a little bit about how all of our hormones need to be in balance. How do we ensure hormonal health? I think two things which are very important: try and avoid excessive weight gain as much as possible, and eat healthy. Now, it's easy to say avoid excessive weight gain. What are the simple things that we can do to avoid excess weight gain? It's important to not only eat right, and I'll talk a little bit about what I think eating right means. It's also important to sleep right. It's also important to sleep at the proper time. So timing is also important. I put this picture up to say that sleep is as important as anything else in preventing diabetes. It is not a question of we sleep too much, so you get diabetes. In fact, for most people, because they don't sleep enough, they sleep too little, that people are getting diabetes. Over the years, there are interesting studies. Last 100 years or so, people are sleeping less and less and less. Why are we sleeping less? Because we have artificial light. If you go back about 100 years, we all know that we would, most people in India would finish their dinner by about 6 o'clock or so, because there was no light. So when it was daylight outside, as the sun was starting to set, we would finish our dinner by, say, 6 p.m. That is an excellent thing. It was only because of the introduction of electricity and artificial light that we started staying up later and later and later. Now, this also brings into focus another important aspect of hormonal health. All of our hormones are very much in sync with the outside daylight cycle. When the sun starts to rise outside, certain hormones in our body start being made. When it starts getting dark outside, when the sun is starting to set, certain hormones start coming down and certain other hormones start increasing. For example, melatonin. Melatonin is a hormone that starts getting secreted when it starts getting dark outside. Why am I mentioning this? A lot of hormonal problems, particularly among young girls and men, occurs because people are not sleeping at the proper time. They go to bed very late. They're looking at their cell phones, and they are staying up late. So because of that, they are not getting enough sleep. Not getting enough sleep can definitely affect your hormones. There is no condition like sleeping too much. If, like you can hear, I think someone has fallen asleep. I'm very glad, let him sleep. If someone falls asleep when they are watching, say, a movie, or when they are watching, that means they have not got enough sleep. Your body will give you the signal. If it is telling you to sleep, please sleep. If you're ready to wake up, you will wake up. If you tend to fall asleep very quickly during meetings like this, a lot of people, it is a medical necessity. Sleep is as important as eating and taking medicine. So sleep is very, very important. Ensure that you sleep for an adequate number of hours, which may be between sort of 7 to 9 hours for most people. So you need to sleep enough, and you need to sleep at the right time. Go to bed when it's, say, at least around 8 o'clock or 9 o'clock, and try and wake up when the sun is starting to rise. Again, then your hormones will be in sync. They will be in balance. So sleep is very, very important. A healthy diet, these are my principles. I'm not going to go into detail. No sugar, low carb, moderate protein, high fiber, good amount of good fat. Do not be afraid of fat. So we can talk about it in the discussion time, but I think no sugar and low carb are very, very important in a healthy diet. Exercise, at least these two things you can try and do. Ensure that all of us are taking at least 8 to 10,000 steps in a day, and some amount of flexibility. You can call it yoga, you can call it stretching, you can just call it exercises. As we get older, our joints tend to become less flexible. That is why a lot of people in their 70s and 80s will find that they're not able to bend their knee, they're not able to bend their ankle or wrist or their shoulders. So flexibility exercises are very, very important. So some amount of exercise is essential. Drink lots and lots of water, at least 4 liters a day, 3 to 4 liters a day. Very, very important to ensure that we drink enough water. Unless you have a heart or kidney problem and your doctor has told you to drink less. If you're thirsty, drink. Otherwise, at least drink 3 to 4 liters. Finally, 2 things which we don't talk about enough. Do not be over clean. What do I mean by that? All of us are part of our environment. The sort of studies have clearly shown again and again and again that if we are over clean, we use too much of chemical. We clean our house obsessively, we clean our clothes, our curtains, our vessels, our kitchen obsessively. It is not good for our health. A little bit of dirt, we evolved from our environment. A little bit of dirt is good. Children who grow up slightly more, they're not dirty, but not so clean, not being exposed to too many chemicals, have much less diseases later on in life. They have less incidence of asthma, They have less incidence of skin problems. So don't be over clean. Don't be too worried about some dust and some dirt and some, obviously we need to maintain some amount of hygiene, but do not be over clean. Remember, we are part of our environment. We have come from the soil. We will return to the soil. So we have to understand our place in our environment. So don't be over clean. And another important reason not to be over clean is because of our microbiome. So our microbiome, it is the bacteria living in our body at all times. In fact, very interesting data has emerged regarding our microbiome or the bacteria in our body. Bacteria is not all bad. In fact, most of our health is determined by our bacteria. We have bacteria living on our skin. We have bacteria living in our stomach, in our intestines. We have bacteria living. Very fascinating studies about bacteria. It has been shown, for example, the bacteria in your right armpit is very different from the bacteria in your left armpit. Why? Because we are using our right hand a lot. Left hand may not be different. So the bacterial load in our body is a lot, and it is very much important in maintaining our health. If we keep on using things like pesticides, fertilizers, cleaning agents, recurrent use of antibiotics, all of these things have been shown to alter our bacterial flora and ultimately lead to diseases. For example, people who take antibiotics more than 5 times in a year, if they use antibiotics more than 5 times in a year, they are twice at higher risk of developing diabetes. This is because their bacteria and their body changes. So unless it's absolutely necessary, do not keep on using antibiotics again and again and again, because it changes our bacteria. So the microbiome in our body is a very, very important part of us, and we should try not to change our microbiome. Studies are again coming out talking about how excessive use of pesticides, excessive use of fertilizers, excessive use of antibiotics changes our bacterial microbiome and ultimately changes our susceptibility to various diseases, including diabetes and heart disease and heart attacks. So it is important that we are aware of all of these things. Apart from sleep and light, all of these things also determines our overall health. I think that is my last slide. Ultimately, I just come back to the same thing I started off with. Hormones maintain balance in our body. Try not to go overboard, whether it is the dirt in our body, whether it is the sleep, whether it is the exposure to light, whether it is the food, whether it is the exercise. Too much of anything is bad. Too little of anything is equally bad. So everything ultimately comes back to maintaining balance. Do what feels right to you at that point in time. If you feel you need to sleep more, you need to sleep more. Take that time to sleep. If your body doesn't need sleep, it may not need sleep. Don't fuss over it. Sometimes you may need only 5 to 6 hours of sleep. That's okay. Sometimes you might need 8 or 9 hours of sleep. That's also okay. Our body ultimately is all about maintaining balance. So I'm going to stop here. And I hope at least some aspects of hormonal health and how to maintain a hormonal balance you've understood, and I'll be very happy to answer any questions. Thank you very much, and thanks Vasudha again for inviting me. Thank you.
Thank you, Dr. Jayashree Gopal. It was very enlightening information about all the aspects of hormonal in our body. And I think the last 10 minutes was, you engaged everybody, the slides and everything was very impressive. And I'm sure a lot of people have a lot of doubts and queries. So friends, can I request you to raise hands so that I can unmute you and you can ask a question? Or if you want, yeah, we have a question from our AG Vidya.
Doctor, there is this talk about this pineal gland in of late because of this COVID and the constant thermometer gun pointing. Could you tell us a bit about that?
I don't think the pineal gland will sort of is that sensitive. So there's this little bit of pointing for like, I mean, literally it's what, like a second or two. I don't think it's going to affect. So I wouldn't worry. But I do have to say, I wouldn't trust the thermometers. You know, we've seen those thermal guns measuring temperatures anywhere from, like for my mother, the corporation people came home and measured a temperature of 92 degrees Fahrenheit. So I wouldn't trust the thermal guns anyway. I don't know how well they work, but I don't think that like that split-second exposure is going to cause any problem with the pineal gland. I wouldn't worry about that. Pineal gland is affected. I would be more worried about the constant exposure to light at night. You know, when you're lying at bed, you have your the light which comes from, for example, you know, your TV has the little blue light even after you turn it off, or, you know, your charging devices which have that red light. All those are actually more dangerous for us. So
Okay.
that type of exposure we need to minimize.
Okay. Thank you, doctor.
Yeah, friends, any more questions from the audience? I'm sure, you know, somebody would have, or I have a doubt. Yeah, we have Dr. Manjunath Rao. Yes, I will unmute you, sir. Yes, sir, please go ahead.
Good evening. I would like to know if liposuction can alter your diabetic status or prevent you from getting diabetes. Liposuction.
No, the brief answer is no, because liposuction doesn't alter your metabolism. If you want to lose weight and prevent diabetes, then it has to be done through the procedures called bariatric surgery, where your actual body fat is reduced. In liposuction, yes, it's more of a cosmetic procedure, but it does not alter your metabolic aspects.
Thank you, ma'am.
Thank you.
Yeah, friends, do we have any more questions? Okay, ma'am. I have a question, but I don't know how real is that you know, chemical. So there was a film in the year 2014 called Lucy. Okay, so she's injected with a chemical called CPH4. So that chemical CPH4 increases the abilities of our bodies, that, you know, a body becomes a kind of a supercomputer, and she absorbs all the information data in the world. But when I Googled it, our body produces that chemical called CPH4. Can you just you know, enlighten us on that? Because it is not actually related to hormones, but since it is produced in the body, so I thought I would ask that.
I do not know about it. Is it I do not know about it, honestly. I don't want to hazard a guess beyond saying that certain chemicals increase our sensitivity. There are some people who have an enhanced sensitivity to the environment. That is about the only thing I can think about. Like some people are more sensitive to noise and some people are more sensitive to light. That is well described, and that is more of a genetic thing. I do not know about this chemical, honestly. So I do not want to comment on it.
Okay, ma'am. Okay. So, friends, do we have any more questions, or shall we end the question? Yeah, you have Reggie here. Yeah, Reggie, 1 second.
Doctor, I have a question. A very simple thing like switching on, keeping the light on in the night without switching it off. Would that also cause something like a hormonal imbalance inside us?
Yes, yes, very much so. In fact, several very elegant studies have shown that in the labs, in lab animals, but also in humans, in lab animals, animals that are exposed to constant light right from birth have a much reduced lifespan. And in humans, it's shown that Eskimos, who are more, who in general, you know, their circadian rhythm, obviously, half of the year they're in darkness and half of the year they're in light. One of the reasons it is postulated that Eskimo women have a higher incidence of breast cancer is because they got exposed to too much of light. Like I was saying, you know, this inside light that we have, exposure to light, they postulate that it is one of the reasons why they are exposed to, why they may have had a higher incidence of breast cancers. And particularly for women, exposure to light at night has been shown to increase the chances of weight gain. So particularly when I talk to young girls, you know, with irregular periods trying to get pregnant, one of the important aspects of regulating their cycles and, you know, trying to lose weight is this also. They need to be very careful about exposure to light at night. It is, you're not going to get dramatic benefits, but over a period of time, it is a very important aspect of regulating your hormones.
Thank you.
Yes.
Sharad, There is one question here from the audience, Radhika Natarajan, who says, what can be done for vertigo? But I just wrote the message back that vertigo is usually not a hormonal issue and we should consider it offline. It's not relevant to this topic.
Okay.
Or
Fine.
Jayashree, would you like to answer? Do you think it's got any relationship to hormones?
Not directly, no. Unless you have a hormonal imbalance like low sugar or high thyroid or something like that, it can cause vertigo. But otherwise, usually I refer them on to an ENT doctor and have them get evaluated. Yes.
Okay. We have two people asking. JRS.
Hi, doctor.
Hi.
It was highly informative, and hearty congrats to the entire team who was put across this meeting. And it was wonderful you made. I don't think hormones are really interesting. People who are not connected to it, it's like a layman's view, but you have made it very, very interesting, very, very simple to understand easily. Madam, I have one question. You said, like, talking about the clean, not to be too clean. But today's scenario, for this unseen monster, Corona, we are all forced to be over clean, using a lot of soaps, a lot of sanitizers, and forcing all our workforce also to do it. Just a tip from you, ma'am, how we can really manage that. Because we are getting exposed to too much of these artificial things to keep ourselves.
Yeah, so I don't think that, I think it's an excellent point that you're making. I'm not saying, give it all up right now. In the Corona time, it's going to be slightly different. The few months of sort of obsessive hand washing, I don't think is going to matter too much. I do not know. I don't think so. But this, I was talking more from the aspect of, children who from a very, very young age are brought up with a lot of exposure. For example, studies have clearly shown that the children who are more in contact with, say, farm animals from a young age, who grow up in farms, have much less chance of developing allergies and what we call autoimmune diseases later on in life, things like arthritis and some other things. So that is where this whole concept of growing up more in sync with our nature. So don't worry about, I'm not saying go out and pet the dog that is there on the road, but don't be obsessive about it if it comes in and lies down inside your house. I am obsessed about it. So that's why I'm mentioning that as an example. We don't need to worry about it too much, because all of this distribution of the bacteria and viruses around us is what ultimately helps us maintain our immunity. Now, coming back to this issue of the coronavirus, I think what we can do, two things: maintain our immunity. And maintaining our immunity is all of the things that I mentioned anyway, which is, going to sleep at a proper time, waking up at a proper time, eating healthy food at all times, all this exposure to light at night. All these things are important for us to maintain our immunity. Second is reducing the quantum of virus exposure. Now, the people who are prone to getting an infection, it's been clearly shown, for example, people like, say, anesthesia doctors who are doing procedures and they're getting a whole load of the virus into their, getting exposed to a large load at the same time. If you get exposed to a relatively lower load, your immunity may have a chance to control it. So reducing that viral, sort of that load of the virus, prolonged indoor exposure as much as possible. Ventilation is very important. Leave your rooms and your houses open. I'm sorry, am I?
Yeah, I think you have a problem with your net connection.
Did I get, sorry, did I?
No,
Sorry.
Ma'am, your audio was, but the video was going off and on.
Okay, sorry. So I was just saying, just reduce the quantum of the viral exposure by ensuring cross ventilation, double masking, simple things like if you go to a crowded indoor area, come back and immediately wash your face and gargle, just do a saltwater gargle. So simple things like that may help to reduce the quantum of the virus exposure.
Okay, ma'am. Thank you. Oh, we have AG Dr. Ramkumar with a question.
Yeah, good evening, Dr. Jayashree. That was a very crisp and consolidated overview of the various endocrine hormones. Thank you for that. I just have one question regarding this vitamin D. Of late, we have been noticing that many in the population are having this deficiency, and it is very frequent. Where do you think, as citizens, we have gone wrong, or is it that the reagent is playing too much of a havoc that the measurements are not? I don't know. I shouldn't use the word, but that's what is the observation. What is your suggestion and advice?
Yeah, it's a topic for a whole other talk. but I think one is we are over diagnosing vitamin D deficiency.
Okay.
Unless you have symptoms, I don't think it matters. Second, all of us are getting it because of less sun exposure.
Yes.
Partly because of pollution and partly because we are just not out in the sun. What is a normal good level of vitamin D? I do not know. Probably the levels we are classifying as deficiency may not be deficiency.
Okay. Because it is more associated with all this body aches, fibromyalgia.
So if you have symptoms and you check it, that's different. But just doing it willy-nilly for the whole population and then saying someone who's completely having no symptoms and saying you have vitamin D deficiency may not necessarily be the case.
Okay. Thank you.
Thank you, doctor. We have one question over the chat box. Someone has asked, Sivan Ram has asked that, the light which is emitting from the AC, which is switched on all day and night, does it cause a harm?
Well, I mean, like I said, light at night means any of these, I don't know what lights they are. I'm not a physics person, but that laser type light. I think you can choose it. If you need to have your AC on, at least turn off the rest of it. I can't pinpoint and say it is going to cause a big problem, but every little thing adds up. So look at and see where and all we can try and minimize the exposure.
Yes, ma'am. Thanks a lot. So I think, Dr. Vasudha, we will end the Q&A.
There is a VK who had raised hand for a long time.
Yeah, I asked him. He said
Okay,
I asked him over the
right.
chat.
Thanks.
1 second. I asked him if he has a question, but he hasn't replied back. Yeah, Mr. VK, are you there? Okay, so we will end the Q&A to Dr. Vasudha. So now I welcome President Rotarian Rishdan of Central Elite to propose the word of thanks. It's all yours, Rishdan.
Thank you, Sharat. First and foremost, I would like to thank our
Rishdan, you have to be more audible.
Sorry. Can you hear me now?
Yeah.
First and foremost, we would like to thank our speaker, Dr. Jayashree Gopal, for a wonderful session about the common hormonal disorders. You presented this whole, the presentation was in simple language, ma'am, and in simple terms, and with very relatable illustrations and example. I'm sure all of us have a bundle of knowledge to take back from this session. It was a delight to have you with us today, ma'am. Thank you so much.
Thank you.
I would like to thank our district officials who have taken their time out to attend the session today. Special thanks to Rotarian Vasudha Rajshekar, our district chair for disease prevention and treatment, for taking the initiative to conduct such interesting sessions. I would also like to thank our AGs of all the 4 regions who have supported and helped us in putting the sessions together. Our heartfelt thanks to all the presidents and their team for their active participation. I would also thank all the presidents in the organizing committee, and a special thanks to our MC, Rotarian Sharath, for ensuring smooth flow of events. Thank you, Rotarian Hemlata, madam, for being the coordinator and making everyone work towards this session. Once again, thank you all for attending and for their active participation. Wishing you all a great weekend. Thank you.
Thank you.
Thank you, Rishdan. A wonderful word of thanks.